Welcome to Unshakable Belief, where we dive deep into stories of resilience, faith, and finding your purpose. I'm your host, Monica Connolly, here to help you unlock your inner strength and take action toward a life you love. Let's get started. Welcome to Unshakable Belief. Today, I'm incredibly honored to introduce my friend, Kim Witzak, an inspiring global drug safety advocate, a speaker, and a passionate mental health reformer. Kim's life took an unexpected turn after the tragic death of her husband, Woody. This devastating loss sparked her commitment to raise awareness about the dangers of prescription drugs and the need for greater transparency in healthcare. Kim's advocacy work has made her a prominent voice in drug safety reform. She has worked closely with the FDA, pushing for stronger regulations to protect consumers. Her story is one of incredible courage, and today she'll be sharing her journey, and we will discuss her continued efforts to bring change to the healthcare system and how we can all contribute to a safer, more transparent approach to mental health treatment. Kim, thank you for being here. I am grateful to have you on the show, and I know that your story will inspire my listeners.
Thanks for having me. I'm looking forward to our conversation.
So, your journey into drug safety advocacy began with the loss of your husband, Woody. Can you take us back to that time and share what it was that changed in you to allow you to go from sitting in personal grief to becoming a vocal advocate?
Oh, well, thanks. Gosh, it's hard to imagine that's been over 21 years ago. Like in 2003, I was happily married to my best friend of 10 years, Woody. We're just starting to talk about having a family. We both had successful careers traveling. However, on August 6th, and I always say that we're all one phone call away from our entire lives changing. And I got that call from my dad. I was out of town again on business, and my dad called to tell me that my husband, Woody, of 10 years, was found dead, hanging from the rafters of our garage. In that phone call, like, as you can imagine, my entire life just went up in smoke. And it never made sense. Woody wasn't depressed. Like, I was like, what? It's never made sense. Woody had just started his dream job with a startup company and was having trouble sleeping. And Woody went to his doctor and was given a sample pack, a 3-week sample pack of Zoloft, which is an antidepressant, and was told that it would take the edge off and help him sleep. And I happened to be out of the country the first 3 weeks that he was on the drug. So I wasn't even there when he got put on this drug. And I happened to be in New Zealand. I come home and I'll never forget something. It was about a week before Woody's death. Woody came walking through our back door in a blue dress shirt, sweating. He's crying. He drops his bag at the back door and he falls in a fetal position. He kept going, Kim, you got to help me. I don't know what's happening to me. My head's outside my body. You got to help me. And he's rocking back and forth. And I remember like, I don't know. I've never seen that before. Right. And so I'm like, we calmed him down. We prayed, we breathed. He called the doctor and the doctor said, you got to give the drug 4 to 6 weeks to kick in. And every night the next week, Woody would come home because he was like still running during this time because he was super anal and he kept track of his running shoes and how many miles, but he always would say he couldn't run like 10 miles what he was training for. He was about able to barely get like 3-4 miles out every day, but he was running. He was working. He was planning. We booked trips. So you can imagine when I got that call from my dad who said Woody was dead, because I hadn't heard from him all day when I was out of town. So I'm like, hey, do me a favor. I don't think anybody in my family was expecting that. But that night, as I'm sitting in Detroit trying to figure out how to get home, the coroner got on the phone and asked me a question. Was Woody taking any medication? And the only medication Woody was taking was Zoloft. And she said, we're going to take it with us. It might have something to do with his death. So that was kind of clue number one, I guess. And then the other that happened that same day that Woody was found, the front page of our newspaper had an article that said the UK finds link between antidepressants and suicide in teens. And so both of those the same day And then with an intuitive, like everything in my body is like, there is no way Woody killed himself. Like, there is no way this guy who loved life. And I still, 21 years today later, and when I tell this story, and I tell it a lot, I keep still thinking, how in the world did I ever get caught up in this? Which eventually became my purpose. And now I look back and go, wow, maybe, when things happen and, I don't think you could have ever told me then, because I was just like trying to figure out what just happened, right? And my whole life fell apart. But now looking back, and I think that's the thing when you connect dots, you're like, God, maybe that was my purpose this whole time. Like the fact that I had two things happen that exact night that Woody died, and there were no other medications, because it became our like purpose and our battle for Woody, and started going out to DC because we had no warning. We knew nothing. And it became kind of what we did to get black box suicide warnings put on these medications. And that was 2004 and 2006 up to age 24. And to this day, there are no warnings for all ages. So it was a learning journey. I had a big lawsuit against Pfizer where I got documents out from under seal. I told the story to anybody that would listen. I was just trying to, make sense of my own grief, but also honor who Woody was, and not let that be the last act, because he always said, will never judge my life based on how much money I make or my career. Be based on my family and my friends, and leaving the world a better place. And so this was my way that I could honor those words of something that he said and believed so deeply.
Yeah, I have heard your story and we have talked about Woody and I still get chills when you tell that story. Now you have spent years working with the FDA and other organizations to address drug safety concerns. Can you tell us about a moment when you felt that your work really made a difference? And what was the emotional impact of that for you?
Sure. Well, I would say first thing I did was I literally got on a plane and started going to DC and met with the officials of the FDA. And just to, say, wouldn't you guys be interested? A guy went from this to this and he killed himself. Like, why wouldn't you care? And they literally, I remember them saying, well, this is an anecdote, and it didn't happen in the double-blinded, placebo-controlled study. That was literally the head of the FDA that said it. So I was like, are you kidding me? Like, this is my husband, and I had all these other people with me. I'm like, we are not anecdotes. So we created these buttons that I created, that I made everybody wear when we would go and speak in front of the FDA at these big hearings, that said, we are not anecdotes, we matter. And so I think what I learned, and that was like one of the very first meetings that I'll never forget, it literally fueled something inside me that I was like, wait a minute. They are looking at things as not the real world situations of what happens to people, but they're looking at and getting drugs on the market based on the clinical trials that the drug companies control. And you start learning the system. So I feel like that gave me this first insight into how it works, but also the important role that I played, which is the voice of the everyday average American who's going to the doctor, who did what Woody did and what I did, which was trust that the FDA, obviously a drug that gets approved, it must be, and it's advertised, right? And it's given to you by your doctor. So it must be safe, right? And I learned that it's not really that way. So that would be something that I felt like my voice made a difference. And the fact that I showed up continually, maybe that little girl that was trying to always get like boys to like me when I was little, as I always say, that persistence, or pushing my mom and dad to like, let me do this. Maybe what I realized is, wow, that actually served me well, because I didn't give up, and I kept going, and no was not going to be an answer. No was not an answer. So, good question.
Wow. Well, you talk about the importance of transparency in healthcare, and you've experienced firsthand the consequences of its absence. How can people contribute to a more transparent and accountable healthcare system? I think that, so many people, when they have a situation like what you had happen, they have no idea. Like the thought of going up against big pharma or going up against the FDA is completely overwhelming to them. What are simple steps that they can take to take back some of that control and feel like they're able to go in and help make a difference?
Great question. I think for starters, I think this idea that to always remember no one is going to care more about you or your loved one's health than you. The government isn't, healthcare providers. I always say everybody's for the patient, and the patient is another word in my mind of customer, the consumer, because it's a big business. And so I think it's really important to be your own advocate and not blindly give away your trust or think because they went to school and they have a doctor or they have all the degrees behind their name that they're smarter than you, because I think there is nothing better than a mother's intuition, a wife's, anybody who's watching. If you know your parents know the kids, like, if something isn't right because you have seen it and there's a trust. So I think that we have to remember that we are our own best advocates and need to be the voice of ourselves, but more importantly, not be afraid to challenge them and ask questions, and remember that it's the practice of medicine. It is a practice. It is not a one size fits all. And also to understand that to go do your own research too and ask questions. Like had no idea. I can tell you right now, we had no idea when Woody got that drug. We didn't know that it was even an antidepressant. He went in there because he wasn't sleeping. And I learned about off label, that once a drug is on the market, they can use it any way they want to prescribe it. So I think a simple question of like, is this approved for this condition would have been nice. Or if they would have actually said to Woody, it's an antidepressant, he would have said, well, I'm not depressed. Or if they would have even said, what are the benefits? Like, not always when you go, because, you usually go to the doctor because you're not feeling well or there's something going on. But I think it's okay to ask the question of, is this the only thing? Is there another non-pharmacological option? Like, should antidepressants really have been what they gave Woody, first of all? Or should they have said, hey, have you tried this, or that, And this idea of looking to see if there's warnings, or so that you have the whole picture. But at the end of the day, when something does happen, and I was shocked to learn that properly prescribed medications is the third, or some say fourth, some say third, there's debate, of most leading cause of death. And so I think it's a lot larger, and what happens with harms in medicine is that they're one-offs, your family, my family. And unless you start connecting the dots, you think it's isolated. But the reality is it's probably wider spread than you actually think it is or believe it is. So, I say, remember, don't be afraid to challenge and ask the questions. Even with all the challenging that I have done, I had to have a endoscope where it goes down your throat, right? And I kept asking the doctor all these questions. And he looked at me and he goes, do you know how many of these I do every single week? And I looked at him and I was like kind of shocked that he talked to me like that. But more importantly, what I said to him is I'm not insulting your intelligence or your ego. I have never, like, you're putting that thing in my body. And I've never had this done. So I have a right to be afraid and ask questions. And so I say the same thing to your listeners. We all have a right to ask questions. And if something doesn't feel right, look right, seem right, you can push back. They're not the boss of you.
Yeah, and that I think is huge. So many times we see people. I've worked in emergency services and I've worked in private providers' offices, and so many times people are afraid to question what their doctor says. It's just this is what they said. I don't ask questions. I don't. They have the MD behind their name. I don't, and I'm just going to do what they say. And so, really advocating for yourself. And I remember I had some patients that did the same thing. They would question and say, like, is this really necessary? Is this the best option? And I would see some of the providers get frustrated with that. And I would tell them, remember that you do this every day. You do this procedure every single day. But for this person, it's probably the only time that they will ever have to have this done, and they're terrified. So, what you do every day and is very common practice for you, and you don't think twice about it, this is something that they've never gone through. This is something that they will probably, hopefully, never have to go through again. And so, give them the grace. Let them ask those questions. Let them go into it feeling educated and having that trust with your provider.
Absolutely.
Yeah.
Absolutely. I think that's a good reminder for, anybody. I think there's a real opportunity for, I like to say transformational. Like I know I've done a lot of my own personal work on my own, like after Woody, not having nothing to do with this work, right? Just about, looking in the mirror at myself and doing my own mirror work and, looking at old stories or having to change. Why do I believe something? Where did I come up with this belief? I feel like there's a real opportunity now with healthcare and our whole like world we are in dire need of transformational leadership and leadership that is willing to do their own internal work and remember like you raised a really good point, which is, for your doctor, for your provider that maybe does this every day, like just like I do my advertising stuff every day, and I think, well, duh, it's so easy. How does not
Yeah.
everybody understand how this process works? It's a great reminder to take a step back and where do we have an opportunity to make it easier to have grace, especially when you're talking about the health and well-being of people.
Yeah, definitely. Well, your work has made waves in the pharmaceutical world. What ways do you think the industry has changed since you started your advocacy? And where do you still see room for improvement?
Well, I think I would say it's still an honor when I know that Pfizer still watches what I do because I've gotten removed from committees, the FDA. So I think there's a lot of room for improvement. But I know that my work has made a difference in that, you know, we got warnings put on these drugs. The fact that I earned a seat, I still don't know how. I think God got me that seat on the FDA advisory committee where I get to be the voice. So I know that my work has made a difference in making sure that there's a lot of people in the patient environments, the patient stories that are being told, but it's from the benefit side or we need more medications or we need more treatments. I'm the reminder of the ugly side, but at least I'm being there at being at the table. One area for improvement, well, there's a lot of areas for improvement, but I think one big one is, there's no funding for this work of the safety harm voice. It's because a lot of the other patient groups do get funding from pharmaceutical because it is they get from companies, they get and that voice is represented, but the voice of the harmed is not. And so we're always trying to figure out how do we, like I just heard of another organization that was completely independent, doesn't take funding from pharma, and who's done work for the last 30 years, just closed their doors today. Women's Health Initiative. And we need the independent voices out there. We need the people who don't have the conflicts of interest, who don't have self-interest to protect. We need to change the revolving door, that atmosphere that goes between the regulators to the companies and companies into the regulators, because it's part of the system. And I think we need more transparency. And also, I'd love to see, my profession is advertising. And I think a big, huge area that could use improvement is we're one of only two countries in the world that allow drug ads. We need to get these drug ads off the air. And I know I'm not popular with my friends in the business when I say that, but it has a huge impact on you and I. We all think they're annoying. Let's just all admit it. But it's not that. It's the fact that it drives up costs, unnecessary visits. Like, it also controls the media because it's one of the largest advertising spending. And so it influences what we get told and what we hear as the general public. And so these are some of the areas that I think we can do and have some improvements that are needed.
Definitely, and I can attest that I can't tell you how many times I had patients come into the office and they asked for a very specific drug because they saw a celebrity advertising for it on TV, and well, so and so uses it and it works great for them, so I want to try it. And sometimes the drug was completely irrelevant to their medical diagnosis, but they saw that face that they latch onto, that of a celebrity that they feel like they can trust, and they just immediately think, I need to be on that. And so I think really I'm shocked but not surprised that there's not funding for that voice that says, hey, let's take caution here. Let's slow down. Let's look at what the other side of this is, because it doesn't make them any money if nobody is using the medication. And the pharmaceutical companies, it's a business, and that's what it comes down to, is them making money. And if something is not making them money, it definitely is going to be something that they want quieted and more swept under the rug.
Absolutely. I think it's that I always say, I have a whole platform called Selling Sickness that I work on, and it's this idea of cradle to grave, and it's really about highlighting all of the influences, the spider web between the doctor-patient relationship. That's the system that is behind it. But at the end of the day, even like, I think it's important to expose this and educate people, because it's about information and education. But I keep saying I would love to, like, I want to go upstream. I want to go upstream. Like, this is the work that I'm doing is downstream. It's taking people out of it's like the baby in the river. It's taking the people who are like, why is there a baby? Like, we need to go upstream and see who's throwing the baby. Like,
Yeah.
we need to go, and how do we keep people healthy? And why aren't we giving incentives to keep people healthy in the beginning, like from the beginning? And like, what can we do with food and exercise? Not wait until people are in the system that are sick. Like, so I really believe that there is an opportunity. I just want to figure out, how do we financially make it so that, healthcare, like, I would think insurance companies would want to pay for that, but I don't know, there's a lot of people that have to come together. And I think it's also, I think what I like about the time right now is there is momentum and excitement to maybe think that we need to shift how we look at things, the systems in the world. And I remember years ago when I first started doing this work, I had a mentor, and he asked me a simple question of like what my goal was. I'm like, I want to change the world or something. He goes, that's great. Or I want to make people safer or whatever. And he goes, you do realize the only way that's going to happen is when the change starts with you. And I think this is a great opportunity for all of us looking at whatever is the change, if we want to change something, I have to look inside. And so I think this is, let's go change what we can do to make people healthy. Like, why do we want to keep, and at the end of the day, as I saw, you take nothing with you. You take and you leave nothing with you but love and memories, and you take nothing. You're all the money, all the beautiful things. I mean, there's nothing wrong with it, but not at the expense of people's lives. And people like Woody, and I've learned this and seen it way too many times, especially in this business of healthcare. There's too many people that are considered accept, like there'll always be somebody who gets hurt. Okay, that's all right if that's the case, but it should not be an acceptable collateral damage or the cost of doing business. These are lives.
Absolutely. And I definitely, my own journey, I became a certified holistic health and wellness coach after my doctor, who I had been working with for years, was telling me that what he was doing wasn't working, that I was going to die and it was going to be sooner rather than later. And it was so frustrating. I remember thinking, I've done everything that you've told me to, and I've tried this medication and I've tried that medication. And it was completely pivoting away from medicine, which I had been involved in healthcare for years and really was passionate about making sure that people were taken care of and were healing, and realizing that I was going to have to go and find my own way to fix what was going on with myself, and took the education that I had and used it to heal my own body. And so I love looking at the aspect of what can we do in a holistic fashion for people before we look at medication first. What can we talk about? Can we talk about their diet? Can we talk about their stress levels? What are things that we can address that are going to help them heal? Because in so many cases, they have issues that need to be fixed mentally as well. And when you start working on those issues, the lack of sleep, the high stress levels, things like that, those all influence your body, and those all affect your body in a way that weakens it and makes you able to get sick easier and things like that. And so, really looking at that holistic approach and thinking about whether or not is medication as the first option really the best option.
Mhm. Absolutely. I think you touched on something that we should never forget, that we are mind, body, spirits. And so it's like the whole person, and not, we tend to, or the system right now is set to treat symptoms, right? And it's still a practice of medicine. So, like your own journey, throwing everything, doing everything. There's, everything they're trying. And at the end of the day, that's not what worked. It was when you actually got in there and started looking at some of these other areas of the whole person, the whole Monica, not the physical manifestation of things that were going on. So I love the work that you're doing and the coaching, because I think, imagine, I always have these, like, imagine what it could be like, if we actually treated the person, and we took control and really looked at, not in isolation but together, as the whole person, and we see the whole person.
Definitely. Right. Yeah. Look at it as a whole person, not, there's so much that encompasses people. It's not just looking at physically what's going on. You have to dig deeper than that.
Absolutely.
Yeah.
Absolutely.
Well, how do you stay motivated on days when you feel especially challenged? Maybe something didn't happen the way that you wanted it to with your work. What keeps you moving forward?
Well, I think for me, one of the first things is my faith is a foundation for what I do and how I live my life. It has to be, because and having that bit of gratitude, because there's a lot of times I want to quit and I'm like, why am I doing this work? And then I have to go into prayer, my dedication, my writing. And then I also, my physical workouts are really important to move my body, to move the energy when I don't feel like it. And I do it anyway. And I do it anyway. Even if I don't feel like it, even if I go for like 10 minutes and I have a crappy like workout, I'm like, nope, you did it anyway. So like instead of beating ourselves up, and I think the importance of the talk to ourselves, and what do we say? What are the voices that we and the stories we tell ourselves when we're like, I'm just going to stay in bed, like, or I'm not. Why? And there's some days where you're like, at the end of the day, you're like, all right, well, let's just try this all over tomorrow. It'll be another day. So there are times like that too. But I think it's important to remember that this is our only life and we get a choice. And everything that we do, and every day is every minute's another choice. Like even if you didn't make the right choice that you thought was the good one today, you can make it a different one tomorrow. So I think that really helps me is to remember nothing is of forever, and to take time to like gratitude, get out in nature and realize, get out of your head. Because sometimes when you're in your head in your own work, you forget that there's a whole life outside of what lives here and what you do every day.
Yeah, definitely. Well, you have shared such a powerful and personal journey of advocating for drug safety and transparency after experiencing a tragedy. So, as we wrap up, I would like to ask you about butterflies. And I know that they have a special significance in your life. Could you tell us about that connection and what the symbolism of butterflies means to you personally?
Ah, like yes, I have butterflies. I'm looking at all the butterflies I have over at my desk. I've got them. I have one tattooed. So initially, I will say, when right after Woody died, I had these white butterflies. It was the first time I was going to go for a run because we ran together, and I couldn't. It was like maybe 2 weeks after Woody died, and I could not run. I just walked. So there was that choice that I got up, but there was like this white butterfly that followed me almost around the whole lake. And then it kept showing up anytime I was like with Woody's parents. Like, I mean, I still had a butterfly. I was outside at night with my niece here. Everybody knows that I would talk about Woody. So like people thought it was Woody. Then it really became about the butterfly represents transformation and your own journey, and that the only way butterflies don't come into the world to be they're not butterflies. They have to go through the dark, the gooey, and they have to shake it off. They have to like before they emerge as a butterfly. And so there's the personal aspect of what a butterfly means in the transformation. And then now I really see butterflies also as the butterfly effect, right? So my little work, my work maybe inspires somebody else's work, and then maybe that inspires somebody else, and then we all start doing our thing. And the power of the butterfly's wings can create, what do they say? Can create a tidal wave across the world by the power of butterfly wings. So I look at that as the ability to make great change, just one person, one voice that maybe was initially inspired by something. For me, it was Woody, but it also took my personal journey to now then go be that voice that can be the wings that can help spread the energy to create more goodness in the world.
Love it. Yep, I love hearing your butterfly story. So, is there any upcoming projects that we should be watching out for from you?
Well, let's see. I'm getting ready. I'm doing a ton of work, podcasts or interviews on other talking about the whole new administration that's coming in. So that's going to be fun and challenging. I'm also working on a docu-series project, The Unselling of Sickness, selling sick. It's kind of again with that project that I'm working on, and I'm going to make sure that this message is on more stages. And I want to, get to, I feel like I've been doing a lot of my work in this one avenue, but meaning the healthcare space and the FDA, and yes, while I think I'll continue that because I've earned a spot there, still transformation and change. And why I do this is for the everyday person like me that didn't have this information. So I need to be up on the stages to like let people know, the everyday person, like this impacts all of us. And the better and more it makes the whole world better because you're going to keep yourself, hopefully, that you'll never have to ask, how come I didn't know? So anyways, those are some of the things. And I'm going to continue to write on my Substack.
Well, I am excited to, be able to watch you get your message out more. I think that it's something when somebody who is just an average person, they see your message and they see the work that you've done, that really gives them a glimmer of hope if they ever find themselves in that same situation, that they can turn around and they can say, well, look at what she was able to do. And, she didn't have, she wasn't all kinds of wealthy. She didn't have all this influence. She didn't have all these friends in high places. She just went out and told the story and did it again and again and again to help educate and to help advocate for those who can't advocate for themselves. And so I hope that the listeners hear your story and that they are able to see that that's something that they can do for themselves as well.
Absolutely. I say this all the time. If you knew who I was before, I never would have stirred the pot, taken on something. But I have learned the power of a single person doing something over and over and over and showing up, that magic happens, and eventually you're just living your truth. But if I can do it, trust me, anybody can do it. And so I would say find whatever's in your passion, in your heart, and show up, because that's truly where the magic lives, is when we show up and get engaged.
Well, Kim, thank you so much for being with us today. And I definitely look forward to having you on again where we can touch base and talk about some more of your projects.
Absolutely. Thanks for having me, Monica.
Thank you for joining me on Unshakable Belief. If today's episode inspired you, be sure to subscribe, leave a review, and share it with someone who needs to hear it. Remember, trust your journey, embrace your purpose, and let your belief guide you forward.